name is Dr. Bienvenu, and today we will be administering insulin. We will also be mixing insulin. For the first part of the video, we will be mixing insulin, but before we get started with that, we're going to do the administration at the end, so I'm just going to kind of touch on a few things, like checking the patient's blood glucose prior to giving insulin, making sure that you check the MAR, that it is scheduled insulin, that you making sure that this is the correct patient with verifications, armbands, get them state their first and last name back to you, date of birth, making sure that this patient is who they are. This next step we're going to do is the mixing of the insulin first. So I have my cloudy, and I have clear insulin, and I have a syringe, clean gloves, and for the administration part, I'm going to use a tennis ball to demonstrate the administration of insulin. So now that we pick up our insulin, it's cloudy, so we need to gently agitate it. We're going to roll it around and mix it, okay? Making sure that it's thoroughly mixed. Once, for the purpose, I'm going to speed up this here, just for the video. This is mixed now. Take the next one. You don't have to agitate it, but if you want to, you can gently roll it around. Just make sure it's agitated. Not so much shake, just to gently agitate, rolling your hand. The next step is take some alcohol. I'm going to use this as alcohol. I'm going to take alcohol and clean the tops of the ports. Make sure that they're clean. Clean both of them. Allow air to dry them. And now we're going to give 5 units of cloudy. Okay, so this next step is we're going to draw back 5 units. Okay, the top is clean, so don't touch the top. We're going to take 5 units of air and directly inject it into the solution. Okay, did you see that? There's air. Now at this point here now, pull directly out. Don't have anything in the syringe. Now that there's a pressure in here for the 5 units, we'll get back to that after. So at this point, now, so say that was 5, and I need a total of 20, so I need 15 of the clear, okay? So say we're going to pull back to 15. 5 of the other, 15 of this. So now we're going to inject the air into this guy as well. You bevel up and go directly into the center of the stopper. All right, push your air in and pull back to 15. Keeping it straight up and tapping if you have any air bubbles, because air is space, which makes it space that it could be insulin. So no air bubbles, 15. Pulled out. Be careful not to stick yourself. Even though it is clean, it's still, you don't want to stick yourself. Okay, now at this point here, this already has the air in it. Okay, it's clean on top. Now you're going to take it and you're going to sit, bevel up, and go directly in the center, kind of like this motion. And on the table, for the video purpose, I'm going to raise it so you can see. Come straight in, okay, right in the center. Now, I didn't push anything, but the air in it pushed it down to 20. Okay, you're going to pull a little bit on your thing and not allowing any of the other insulin to mix back in the vial and contaminate all of it. Okay, make sure that you don't allow the clear to go in the cloudy. It's the pressure. You see it go up to it, and then you draw it back out. Okay, now that you have 20 total, you have 5 of the cloudy and 15 of the clear. Your insulin is mixed. You then make sure there's no air bubbles. You then set aside the cloudy and clear and pull. You can if you wanted to, but it's already mixed. You can kind of pull back, making sure, and gently roll to mix to both of these guys, but it's not necessary. You just make sure that there's no air. See on the top of it? Make sure that there is no air going to be pushed in the patient. Now at this point here, there's no air. We've properly mixed insulin, okay, cloudy and clear. And now at this point here, we will continue the video with administration. We check the MAR, This is the correct dose. This is the correct patient. The route. We did all our medication administration checks. We went in. We checked the blood glucose. The patient does need it. If it didn't, if the blood glucose did not need insulin, we would not be administering it unless it's a Lantus, which is a 24-hour that's going to carry them over. But the patient's blood sugar is high, so we're going to keep this here, and this is going to be administered to the patient. We're going to use this here as the patient's arm, and I'm going to tilt the monitor down a little bit so we can see me actually do this here, perform this task. Okay, so we have the patient's arm. I go in, I make sure that my patient scan their wristband, and make sure that this is the patient and they do need it. We had all the steps as well earlier. So earlier we didn't talk about this because we weren't in administration, but when we pulling these units out of the Pyxis and typing how many units, we need 2 nurses there to visually see me prepare this, because they're going to have to witness it. Again, most nurses are very intuitive, and it's not good. They just go in and type their stuff and they don't physically see them. Always make sure that you're watching the person pull the insulin out, because you're responsible. You're signing off that is that amount of insulin. So that's that part now. So everything is checked with insulin. We had 2 nurses. We got the medication more. We checked it. We got the blood glucose. This patient needs this insulin. So I go in and I scan my badge. I scan the patient and the tag that's on here, the vial, okay, or the insulin deal, so the computer can pick it up. So I go in, I'm telling them it's going to be a little prick, and we go and I clean the area with a little alcohol. I find my area that I'm going to go and make rotating different sites, not doing it every single time in the same deal. So clean it with alcohol, let the alcohol dry, pick up my syringe, which I still have, and now I'm going to hold it like a dart. I know that sounds horrible, but hold it like a dart. And at this point here, you're going to hold it like this. Maybe bend the needle with this tennis ball, but for the purpose, I'm just going to, so you can see, take it like at a 90-degree angle and insert it straight in. Okay, you can if you wanted to count or whatnot, it's really up to you. But the patient, you just go directly in. Okay, just a clean, smooth motion. I'm not going to go too fast because I don't want to stick myself with the tennis ball, but just a clean one motion. Okay, it didn't go in, you see, but straight in. So that time it got it. You would then immediately push your insulin in. Okay, and you can remove your insulin. There's usually a safety feature with these guys. You can either slide it forward, or there's a thing that closes the top. Now this is contaminated. You do not want to touch this, because whatever the patient has, or they may not have anything, but still it's the patient, it's contaminated. Do not get stuck with this here. Use the safety features. Some of them have safety features, some do not actually. So just make sure that you discarded this in the sharps, and you can document it tomorrow. Do not recap though, okay? That's important. A lot of people stick themselves when they do that. Make sure that you document the time, the amount of insulin you gave, the type of insulin. Make sure you just cover all your grounds with the proper documentation. And that is all to insulin mixing, insulin administration. That is everything. And thank you so much for watching. Have a good day.